have noticed that medical tourism is an untapped potential, an unknown medical specialization. That even we as doctors, we have not explored it and we have not practiced it well. But because you have to understand that medical tourism is a medical specialty whereby our clients access specialized medical services or they come for specialized medical services.
Many times, somebody could have a medical condition that may not be manageable in the confines of our country. Sometimes it can be because of choice. We've seen sometimes politicians or people who have reached a certain level having medical conditions and they feel they should not be managed within this country. And in such circumstances, they need to get healthcare abroad.
My name is Dr. Wabutunga Charles. I'm a member of Uganda Medical Association. I also work with the Mulago Hospital.
My name is Ruba Mchunguzi and I'm a Managing Director of Health and Hopes. I'm a medical tourism facilitator. I head Health and Hopes as the first medical tourism company to be registered in Uganda.
Today we have a very great topic and which we call a medical specialty in medical tourism. So we are here to break and also share with you information. The next time you want to travel or you have a patient or you have a relative, you know who to contact and how to go about it.
For somebody to move abroad, from the stories I've heard in the public, usually there are quite a number of delays. Somebody can have any medical condition that you would think about, and they need to go in maybe a few weeks. But then realize that sometimes there's sort of so much delay from the time the decision is made until the time they have to travel. A number of times, there are quite a number of bills that are involved, starting with processing the visas, passports, the medical bills where they're going to go. And sometimes people don't know where to go. Dr. Charles, tell us, basically, what does medical tourism entail?
In Uganda, you see we have specialized centers. Talk about the Uganda Cancer Institute, the Uganda Heart Institute. These are specialized centers, okay? Now, people come from different corners to access services from these health institutions. So when they do this, they are practicing what we call medical tourism. But medical tourism has three aspects, what we call intrabound, inbound, and outbound medical tourism. You will find that when a person moves from one district to another district, that person has already practiced what we call inbound medical tourism.
From one district to another.
One district to another district. Then we have what we call intrabound medical tourism. We have our friends who move from other neighboring countries coming to our country, Uganda.
Yeah, Congo, Sudan, Tanzania.
For example, here we see an influx of South Sudanese, Congolese coming to the Cancer Institute for specialized cancer treatment. Then you also have outbound, where people move from out of their country or out of their region. For example, you see that many Ugandans keep traveling to India to access specialized medical care. Now, this specialized medical care, at times, it can be available, but not affordable. So affordability is one concept.
Costs.
Availability is also another concept. Accessibility is another concept. So we have to break them. The biggest issue we see here is that even my patients, they find it so hard to access these specialized medical services, whether abroad or even here. So now we need to understand and even educate the masses, even the medical professionals. How can our clients access specialized medical care within our country and also abroad? Okay?
Yes.
Because here, you know, we have what we call patient's autonomy. The patient has a choice on where, how, and who to give him this much needed medical care. So, but people traveling, they find a lot of problems. They find a lot of delays. They find a lot of challenges, not only to access, but also languages.
So what are some of the countries, maybe the destinations where a person can actually think about? Assuming I have had maybe specialist consultation here and maybe they suggest that I should go abroad for other healthcare. So what are some of the countries that Ugandans can travel to for such healthcare?
Thank you, thank you. You see, every country has the area where it is good in. So like now you are going to you are going to send me reports. Now the this patient needs plastic surgery. That patient, I will advise this patient to either go to Thailand or go to Mexico. So if the patient needs a heart transplant, I will not say this patient should go to Mexico. In Mexico, they are not good in heart surgery. So I will say I will refer this patient to either to India or Turkey. So every country has where it is good in. Because like when we are talking about plastic surgery, we have good countries, South Korea also it is there, Germany is also there, but it depends upon also the expenditure of the patient. Because you are not going to send a patient to Mexico where you will have like 15 hours of the flight. It can go to Thailand and get for 7 hours flight or 10 hours flight. So also there is what we consider in. That's why medical tourism, when you travel with medical tourism, you hassle free. Yes.
Interesting, interesting. So, Dr. Charles,
Yes,
what
yes.
is involved? Assuming I've had this diagnosis and now I need to work onto the processes.
Yes, yes,
What
yes.
are some of the steps that are involved?
Now it is very fundamental. I just wanted to take you back because we talked about our referral system in Uganda. Of course, we know that here, our systems here, we begin from health center 2. From health center 2, we send you to a center 3. Center 3 to 4. From 4, you go to a general hospital. A general hospital, you go to a regional referral hospital. From a regional referral hospital, you go to a national referral hospital. That is our referral cascade. But now, there is a missing link. Even these people, if you refer someone to maybe a national hospital, you are just sending refer to Morago National Referral Hospital. But you don't know whom you are going to meet. You don't know to meet him where and how. So you find there is a whole complex of issues. And now patients tend to have what we call delays. So now, and the other concept of our 3Ds comes in. But now I want to tackle the delay. Why our people delay? And also people dare to make decisions. Okay? So we want really to make sure that, as you have said, during the referral cascade, there is a clear system. That even me as a doctor in a health center 4, if I'm referring to this patient, I'm referring to the very, very place where this patient is going to get that specialty. Okay? Because I told you about the accessibility and affordability. So now even patients who are traveling abroad face similar challenges. One, you said yes, there are some people who go abroad by choice. Okay? But there is when me as a doctor, treating doctor, I will say this patient needs a bone marrow transplant. And I know I'm not able to do it from here. I'm referring this patient. Okay? So when I refer this patient, how connected am I with this specialized
Hospital
doctor
where we are
or
sending
hospital
this patient.
in this country? Okay? You find that most of us, even me, if you ask me that, you know what, Dr. Charles, I want to go to Turkey or India to do a bone marrow transplant, or I need a targeted therapy, or someone needs IVF. I may not know, but now that's why we're happy that now we have what we call medical tourism. That one, we have a registered medical tourism organization in the names of Health and Hopes Medicare International Limited.
Health and Hopes Medicare
Yes,
International.
yeah.
Yes.
Registered here in Uganda, able to link our patients or our clients traveling overseas for specialized medical care.
Health and Hopes, it's not registered here only in Uganda, it's also registered in India.
Yes.
So we have a sister company there, which normally receives our patients after reaching there. It started here in Uganda, it started in 2022, but in India it started 2014.
Okay.
So it is having 12 years in existence. Me, the time I spent in India, because I spent in India 4 years, I found that many patients from Uganda do suffer after reaching there in India. First of all, they don't know the hotel where they're going to sleep, because when a doctor, after treating you, the doctor will not have time to take you to the hotel that you go and you get this hotel, you get this hotel. So for us under Health and Hopes, we get for you a cheaper hotel. They say, because I was talking with some people recently about it, I said in India you get a hotel of 60,000 while there is also a breakfast and lunch. They said no, it's impossible.
6,000.
60,000
Oh, like Ugandan shillings.
Ugandan shillings.
When I'm going to sleep, I
Yeah,
have breakfast.
breakfast, lunch.
Wow.
So, but when you go alone,
Yes.
you will be taken in a, like a presidential suits where you're going to be paying $300 every day. So that one also, the patient suffered from, because the patient can be in the guest house. They are working on investigations. Patient is not yet admitted, so that one also costing the patients. And even on the other side of the coin, we partnered with a hospital, which we call joint accredited hospitals, which are accredited by international wide, to be treated our patients from Uganda on a local cost.
Okay.
Let's say if like kidney transplant is 20,000, the patient from Uganda pays 10,000. So it pays a half of the money.
Wow.
Yes. So even we are in negotiation with them to see the doctors, like our Ugandan doctors, when travels there as a patient, to be to be reduced on the cost. So we are working on that as Health and Hopes.
Wow. Health and hopes.
We have an office at the Galloway House at Mulago.
Mm.
But in a nutshell,
Mm.
what I wanted to really people to understand
Mm.
is that one, we have, for example, the best Cancer Institute in Uganda, the Uganda Cancer Institute here. In East and Central Africa, this is the best
It's a center of excellence.
the center of
actually.
excellence, you
Yes,
see?
yes.
So, but many Ugandans don't know.
They come late.
They come late. So we need to champion this and educate the mass to make sure that people come early and access these specialized services.
Okay.
Even the Heart Institute here is doing good work. So, but people, our Ugandans don't know about these services. So, people must contact us to make sure that they access what we call specialized health care.